Hi, I'm Dr. Rebecca Schmidt from Northern Illinois Cat Clinic in Libertyville, Illinois, and I'm here to talk with you about dental disease in the cat. Cats actually get dental disease. A lot of people don't even realize that. Many cats that we see who come in with severe dental disease, the owners had no idea that their cats really should be having some routine dental care, and they can come in with very severe infections. We're going to show you a picture here of the normal dentition of a cat. So this is a cat's skull, and they have very long canine teeth here. These are their little incisors, and these are their molars and premolars here in the back. So this is the number of teeth that a normal healthy cat should have. And those teeth should be nice and clean. Usually around a year of age, cats start to develop tartar on their teeth and collect plaque and tartar. Plaque is a gummy, fuzzy stuff that people get on their teeth also that have bacteria. It's from food and bacteria is in there. That gradually turns into tartar, which adheres very tightly to the tooth. Eventually that tartar can start to push up under the gum line, and then bacteria get up under the gum line and cause gingivitis. So often cats again start to collect that about a year of age. So we here at the cat clinic recommend an annual exam at least for all of our cats. When we do an annual exam, we look at many things, but one of the main things that we do is, of course, look at the teeth. And so we see what has happened. You know, cats can even break their teeth without people realizing that they do. When they're doing that elephant run or horse run around the house and gallop-trotting and run into something, especially these, if we can show the canine teeth also, can be broken when they're running and playing. So we find that out on a physical exam. And if a broken tooth is there, sometimes it will break into the pulp cavity and people have no idea that their cats are in pain and that this hurts. So we find broken teeth, we find evidence of dental disease with tartar and gingivitis, and this needs to be taken care of before it turns into more things. Cats also tend to have something that can be quite painful in the mouth. It's called a resorptive lesion. It's not completely understood how that occurs, but this is what it looks like. So this is a normal tooth here, this is a tooth here, and this is a resorptive lesion. So this really red stuff is inflamed gum tissue that's come in to try to cover a hole in that tooth. So a resorptive lesion is actually a hole in a tooth. It's not a cavity. A cavity is a soft spot in people's teeth. Cats usually don't get cavities. This is actually a hole. So some process in the mouth and in the cat's bone causes this actually the enamel and then into the tooth to be reabsorbed, so there's actually a hole in the tooth. This is very painful. The nerve and blood supply are exposed, and so the body tries very hard to cover that up with the gum tissue, but it's not normal gum tissue, so it bleeds very easily, and if you touch that, that's very painful. Cats are very stoic. They tend to hide disease very well, so they can have these painful lesions and you don't even know it. They continue eating even though these are there. When cats eat, they don't chew their food like people do. Their teeth are made more to create a scissor bite that can cut muscle and cut bone. They don't grind their food like we do. So when they cut that, they don't even use their teeth often to eat the food that we give to them. There's soft canned cat food and little pieces of dry food. They swallow those things whole. So they can eat their food without a whole lot of discomfort when they have these holes. But boy, these teeth ache. And also, again, if they're touched, they're very painful. So this can be found on a physical exam, and this can be corrected. When a tooth has a hole like this, it really can't be saved. It used to be thought that they can be filled, but they really can't be filled adequately, so the tooth needs to be extracted. Before an extraction can be done, here at the cat clinic we have digital radiography, which gives us almost instantaneous x-rays, so we can see the x-ray right away, so we know exactly what we need to do with that tooth. So here is an example of an x-ray. This is an x-ray of a tooth. The crown is here. This is where the roots are supposed to be. This is one of those resorptive lesions. So most of this crown is being reabsorbed. Here's a little bit of normal crown out to the tip, but most of it is being reabsorbed and it goes right into the roots, or some people feel it goes from the roots up into the crown. Either way, the roots are reabsorbed and they actually turn into bone. That weakens this tooth. This tooth will often break. When this tooth breaks, sometimes this again happens before anyone knows it's going on, and this is what it looks like afterwards. the tooth often breaks off, and it doesn't break off level with the bone. It breaks off leaving some of that crown that's still protruding up above the bone. The gum tissue comes and tries to cover it over, and it will cover it over like this, but often there are little pieces of tooth, like right here, that will stick up through that gum tissue that are quite painful. So sometimes people bring their cats in for a physical exam, we'll look in their mouth and they're missing teeth. And yet the people say, well, I've never had the cat taken in for a dentistry, there have been no teeth extracted. This is often what has happened. And yet some of those areas where the teeth are broken can be quite painful. So this can be, again, corrected. When a dentistry is done, it's done under anesthesia, general anesthesia here at the cat clinic. This is very safely done these days. Very safe anesthetics, very safe procedures. We do lots of things here at the cat clinic to make this procedure even safer and as safe as possible. The cats are kept very warm. They do not feel any pain during this procedure. Local blocks, just like in your dental office. The mouth is blocked so that you don't feel any pain. It's numbed. We do the same thing here. So the cat's areas are numbed where the tooth is taken out. We also use very nice, very good pain medications to keep them from being uncomfortable. After they wake up from anesthesia, pain medications are sent home for the owners to give. The cats heal very, very quickly. People often don't know that their cats are in pain until they've had a dentistry done like this. And then they call us back and they say, my cat's playing more, he's eating better, they gained some weight. So obviously this tooth was bothering them and the people had no idea. So it's very important to have your cat come in for a periodic examination to have the teeth checked. We recommend at least an annual exam. If a cat's very prone to these resorptive lesions or more tartar production, cats can also have periodontal disease just like people can, and sometimes they have to come in more often. But just realize that this can actually be corrected and fixed. The periodontal disease can actually be prevented. We teach you how to take care of your cat's teeth at home, so between the professional cleanings that we've done here, you can keep their teeth healthier in the meantime. So we talk with you about those things. We're anxious to help you help your cats have healthy mouths and non-painful mouths. So we're pleased to help you here at Northern Illinois Cat Clinic. Thank you.